I'm a practicing internist, but my career focus has been trying to help train physicians to be better suited for what we need to be as physicians. Medical education is partly about acquiring scientific knowledge, but it's also about connecting and interacting with people in a way that can help them through difficult periods of time in their lives. And it's not that medical students coming in don't want to be good in that area, or that physicians in practice don't want to be better in that area. It's that we really haven't given them the tools to understand what it means to be better. I'm the first physician in my family. Back when I went to med school, I knew about different specialties, but I didn't really know what specialty I wanted to be. And even as I went through med school, I mostly just wanted to be a physician. I was actually doing critical care medicine for a number of years. And of course, in the intensive care unit, there are lots of ethical issues, lots of challenging kind of conversations you're having with patients' families about end-of-life decisions or very difficult kinds of, life-altering kinds of things. And I realized I didn't really feel all that well prepared, and so that was the first seed of understanding how to think rigorously about ethical issues in practice. That's how I got interested in bioethics, with a particular emphasis on doctor-patient communication. Early on, I was doing a lot of work around trying to develop new, interesting, and more effective approaches to teaching medical ethics to medical students and residents, and to some to practicing physicians. And that intersection between ethics and the doctor-patient relationship, particularly when I came here to Stanford, I began to realize, because of the diversity in this community, that there was another area where I felt like as physicians we were not being adequately prepared of how to even think about that, let alone be skillful in that. And so that led to my interest in sort of thinking about, within the broader area of doctor-patient interactions and communication, cross-cultural communication. So we embarked on an initiative to develop a curriculum to better prepare physicians to ask patients the right questions to find out if there's a cultural dimension or a barrier. I think as physicians we start off everything we do thinking about the patient, but the challenges, both the complexities of medical illness and treatment, can sort of push us into viewing that interaction through the doctor's eyes. In my clinical work, in my teaching, in my research, I've tried to be guided by this notion that there's a huge obligation on the part of the physicians to actively work to try to see through the eyes of our patients. And as a teacher, to actively try to see through the eyes of our learners. I think the thing that keeps me going, even on the longest days, is when I feel like that what I'm doing is having an impact. Being able to think about how, through the role I play in the curriculum at large, or the various national things that I'm doing in medical education, the notion that I'm able to maybe impact, in a broader sense, more learners, more patients, more colleagues. And I find that very rewarding. But the other side of high impact is sometimes you feel a very high impact in the clinic office, situations where in the course of a busy day a physician has to go sit down with the family and talk about the results of a scan. The scan shows maybe that the cancer that they thought was responding to treatment is actually spreading. And now their lives have changed. Their lives have taken a right turn from a path they had imagined to a completely different path. And I think about that a lot, and I try and actually force myself to think about it in the moment. It is just going to be one thing I'm doing in my day, but I need to treat it as if it's not just one thing in my day, to treat it with the respect of the profound event it is in that family's life. And the challenge of being an outstanding physician is recognizing that and trying to make it your guide in everything you do.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.